Hi, everyone. Welcome to our newest episode of Nashville General Hospital's Wellness Wednesday Facebook program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesdays is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Today's guest speaker is Dr. Marquetta Faulkner, a kidney specialist at Nashville General Hospital and the Nashville Healthcare Center.
Dr. Faulkner obtained her medical degree from Meharry Medical College and completed her internal medicine residency and nephrology fellowship at Long Island Jewish Medical Center in New Hyde Park, New York. She went on to obtain a physician's executive master of business administration degree from the University of Tennessee, Knoxville. Dr. Faulkner is a former dean and senior vice president for health affairs at Meharry Medical College and continues as a professor with tenure in the Department of Internal Medicine. She is also chief of nephrology at both Nashville General Hospital and Meharry Medical College. As a clinical researcher and scholar, Dr. Faulkner has been extremely active in research projects with numerous associated publications and manuscripts. She has served as principal investigator for several research studies, including the NIH-sponsored African American Study in Kidney Disease. Today, she will share information on chronic kidney disease. If you have comments for Dr. Faulkner after her presentation, please feel free to comment below and we will make sure to answer those questions. Welcome, Dr. Faulkner.
Thank you. Thank you both. I'm just going to share my screen. Okay. Can you see it?
Yes, ma'am.
Okay, great. Okay, I'm going to talk to you today a little about chronic kidney disease. Chronic kidney disease is something that has really bloomed over the last couple of decades. When I first got started, chronic kidney disease was not quite talked about as it is today. End-stage renal disease was talked about more at that time. So what is chronic kidney disease? Well, chronic kidney disease is an abnormality of the kidneys that is present for more than 3 months at a time. So if you have, say, albumin in your urine, a loss of protein, blood in your urine, or you have a radiologic abnormality and you have it over 3 months, that is considered chronic kidney disease. But most importantly, if you have loss of kidney function or decrease in glomerular filtration rate is what they call it, then you have chronic kidney disease. And remember, it has to be over 3 months because 3 months is the time period between acute kidney disease and chronic kidney disease. Now, what is the scope of the problem? Well, there are 37 million people in the United States of America with chronic kidney disease today. But guess what? Only a fraction of those people end up on dialysis. Only about 500,000. And the number one cause of chronic kidney disease is diabetes mellitus. The number 2 cause is hypertension. And how do we get so many people with chronic kidney disease and people not knowing that they have it? Chronic kidney disease is a very silent disease. You don't know till you have it late and you're almost on dialysis that you have chronic kidney disease, unless your doctor or provider has drawn blood and looked at your urine and see that there's an abnormality in one or both of those. Chronic kidney disease has no pain, so the kidneys don't hurt. You won't see any blood in the urine. If you do have some, it might just be microscopic, meaning that you can only see it with a microscope. You won't be able to see protein in your urine. You won't have any feelings of anything in your body. Early on, you will not swell unless you have another type of chronic kidney disease that causes you to lose a lot of protein. Then you may swell early and catch it early. But for the vast majority of the people, 90% will not have any symptoms at all. Now, what are some of the statistics of chronic kidney disease? 76% of the people with chronic kidney disease have either diabetes, mellitus, or hypertension listed as the cause of their chronic kidney disease. Now, who's affected? What gender? Well, females are affected slightly more than males. But in general, it is about the same ratio between males and females, so far as gender. The big difference comes around when we're looking at race. As a percentage of the race, African Americans actually have a lot more kidney disease than any other race. Hispanics have a higher number of patients who have kidney disease. And when we're speaking of a higher number, we're comparing the different races with the Caucasian race. American Indians have a higher number of people who have chronic kidney disease than Caucasians. Native Alaskans, as well as Native Hawaiians. All of these races listed have a much higher percentage than the Caucasian population with chronic kidney disease. Now, there are more Caucasians on dialysis and have chronic kidney disease. There are more Caucasians because they're in a much greater number, 70% of the United States of America. So when we talk about percentage, so African Americans are only 13% of the United States of America, but they're over 40%, 30 to 40% of the end-stage renal disease population. And they're 4 times more likely to have chronic kidney disease than Caucasians. Hispanics are 1.3 times more likely to have chronic kidney disease. So as you see, there's a big disproportion as it relates to race and chronic kidney disease. Now, where do people live? Well, people live in the southern states, Alabama, Mississippi, and of course, our great state of Tennessee, the volunteer state, Georgia, Texas, North Carolina, South Carolina, and Southern California. All of those have the highest population per million of people with chronic kidney disease. So as you can see, the vast majority live in the southern United States. Now, again, what does kidney disease mean? It means a decrease in your kidney function. Your normal kidney function is around 100%, normally. But as you get older and over age 40, you lose about 7% per decade over age 40. So you're going to normally lose some kidney function. And that's why when your labs come back to your doctor, they don't alert the doctor unless you are 60% less than what you should be. So if your glomerular filtration rate is below 60%, then that means that the doctor is notified. If it's above 60%, the doctor is not necessarily notified that something is wrong. Now, what other abnormalities did we talk about for greater than 3 months? Remember, we talked about protein in the urine. So you could have protein in your urine for more than 3 months. You could have blood in your urine for more than 3 months. You could have them both in your urine for more than 3 months. Because remember, a lot of diabetics do have protein and blood in the urine. And of course, you can have abnormal kidney x-rays. Now, when I say abnormal kidney x-rays, some people have chronic kidney infections. And they end up with chronic kidney disease from those chronic infections. And you can usually see this on an x-ray. Now, what questions do you ask your doctor? Because you won't know if you have chronic kidney disease unless you are alerted by your provider or your physician, because they're the ones that get your lab values back when they draw your blood or take a urine sample. So you want to know, what is my glomerular filtration rate? Is it greater than 60? If it is, then I know that it's pretty good. It's not the best, but it's pretty good. Is it less than 60? Then that needs further investigation. They need to look at you a little closer. They need to look at your urine a little closer. They need to look at certain things in your urine. They need to do certain x-rays to see if they can find out the cause of this. And certainly they have to take a different type of history on you to see what might be the cause, or something that you're taking that might have ended up causing chronic kidney disease. Now also, if you have diabetes mellitus, you want to know what your hemoglobin A1C is, because remember I told you that diabetes and hypertension are the #1 and #2 causes of kidney disease. So if your hemoglobin A1C is less than 7%, then that's good. But if it's greater than 7%, it will need further management, because you need to get it down, because diabetes affects the kidney. There's too much glucose in the blood that flows through the kidney. The kidney tries to filter it, and it clogs up in the kidney and causes the kidney to become damaged. If you have high blood pressure, you want to know, is your blood pressure less than 140/90? If it is, it may be good for you. A lot of people like it around 120/80, but at least if you can get it down to 140/90, less than 140/90, then you're doing good. We like it around 120/80. Is my blood pressure greater than 140/90? Then you need further management, because remember, the second most common cause of kidney failure is hypertension. So you really need to get that blood pressure down. The blood pressure is very important. And a lot of people have both diabetes mellitus and hypertension. And they both can affect the kidney, believe it or not. We've had some people who have severe chronic kidney disease. We do a kidney biopsy on those people, and we think that that kidney disease is due to diabetes mellitus. And lo and behold, when we get the information back, it's due to hypertension. So both of these can affect the kidneys, and they can damage the kidneys, and you can end up on dialysis. Now, that's all I have for you today. If you have any questions, I'll be happy to answer them. Thank you for listening, and I'll turn it back over now to Kaylin and Kathy.
Thank you, Dr. Faulkner, very much for your presentation today. We really appreciate it. I think so. We're going to just go ahead and get started with some questions that we have that have come in for you. So first and foremost, I definitely want to ask, what are some key questions, or can you remind us what are some key questions you need to ask your doctor about your kidneys?
Well, you want to know what your glomerular filtration rate is. You want to know if it's above 60 or below 60. If it's above 60, it's not a big concern, but you may want to watch it and keep a close eye on it. If it's below 60, that you need further investigation of that.
Thank you. And then, I'm sorry.
I'm sorry, I just wanted to tag on to that question. So when you go into your doctor and have an annual physical, is that the blood work they will do annually? Because you were saying that 90% of people have no symptoms of chronic kidney disease. So if we're pushing people to go to their doctor, make sure you see your doctor at least once a year for an annual physical, and then they order blood work, is this the typical blood work that they will do, or do you need to request this blood work?
No, this is the typical blood work that they will do when you're going for your annual physical. Then they will do a urine sample as well. So those are screening tools. So once they do those, then you can see whether or not the person has a GFR that's higher or lower. It will be listed on those labs, and the urine will list whether or not there's any protein or blood in it. So usually there are screening tools, and usually the blood and urine that the doctor gets when you first come to the office for an annual physical, they'll get that blood work and urine for you. Now the question comes in if you have a chronic disease already, because remember, chronic kidney disease comes from two other chronic diseases mostly: diabetes mellitus and hypertension. So if you have either one of those, the doctor sees you regularly. So the doctor can screen for those tests regularly on you. And so when you're in the doctor's office, you want to follow it yourself. You want to know what is your glomerular filtration rate. You want to know what's your blood pressure, because both of these affect the kidneys. You don't want to know late. So I have a lot of patients referred to me and they say, I said, do you know why you're here? They say, oh no, I don't know why I'm here. Now they probably were told, but they probably didn't understand why they were coming to see me. And the vast majority have diabetes and high blood pressure, the vast majority.
Well, thank you, Dr. Faulkner. And we do have one more question. So is this something that is like, what are the most common indicators? So would you say, or more so like when you think about your patients, where are the most common demographics of your patients? You see more that are under the age. I know that we talked about the racial demographics, but is there a certain age group that you see? And then what are the most common indicators? And is this something that's hereditary as well?
Well, let me start with whether or not it's hereditary. It is not what you call quote unquote hereditary. I mean, you definitely don't know that if my mother had it or my father had it, will I get it? But we do know that it's familial, meaning that it can run in families, okay? So we know like diabetes runs in families, and we know it's familial, especially type 2, okay? And we know that high blood pressure runs in families, it's familial. So just as that is, so is chronic kidney disease. Everybody who has diabetes mellitus and hypertension does not get chronic kidney disease, but it can run in families. I've had a mother and a daughter on dialysis, a mother and son, a brother and a sister. Then some families would tell me, I have a lot of relatives on dialysis. So it can run in families. Now, the other question you had, I've forgotten what it was. Do you remember?
Yes. I know that we spoke about the demographics, but from your patient population, do you see that this is also something that shows up like in your younger demographic of patients, or is this something that you do feel like, I guess almost, a plea for the young college student that's going back to campus saying, okay, watch what you're eating, watch what you're taking into your body, be more concerned about your health now, so I don't see you in a couple of years.
Okay. Well, now, younger people, say in their 30s and younger, they usually have a different type of kidney disease if they have it. They may have minimal change disease or focal and segmental sclerosis. They have a different type. And they may swell. They usually will come in with swelling. Okay. So that's a different type. They have a lot of loss of protein in their urine. The people that I usually see are those usually greater than 30 on up to 70 and 80. And usually they will have diabetes mellitus or high blood pressure 10 years before I see them. Okay, usually. So the younger population we don't see as much of, because to develop kidney disease, it takes approximately 10 years. Now, for type 2 diabetes mellitus, which is the adult type, they may not know that they've had it for 10 years. So they may say, well, I've only had this 2 years, but actually they've had it a lot longer. Well, have you ever been told that you had an increase in your glucose? Or you ever been told that your hemoglobin A1C was elevated? Well, a long time ago, but nothing happened. I got better. Everything was okay. So people seem to think, well, since I don't have any feelings from it, that the doctor didn't mention it anymore, everything must be okay. But that may not necessarily be the case. Okay.
Well, thank you very, very much for answering that question, Dr. Faulkner. And that is all the time we have today. Thank you again, Dr. Faulkner, for being on to speak with us about chronic kidney disease. And if you, our viewers, have any additional questions or need to see a kidney specialist, please call 615-341-4968 to schedule an appointment with Dr. Faulkner. You may also visit our website at nashvillegeneral.org.
Again, thank you to everyone who joined us today, and especially you, Dr. Faulkner. We'll be back August 25th at 12:15. Our guest will be Dr. Andrew Pierre, our foot and ankle surgeon here at Nashville General Hospital. Have a great day.
All right. Thank you.